So we're going to go over the digit projections today for the hand. It's comprised of 3 projections, a PA, an oblique, and then a lateral. For the PA, you just do a PA hand. For the oblique, oblique hand. And then for the lateral, you cone down to the individual finger. And the thumb's a little bit different, but we'll go over that later. We'll need 40-inch SID. And we've got markers. And for the oblique, if you feel like you need it to make their hand actually stay where you want it, you can use a sponge. And then a 10 by 12 cassette. And we're doing 1 exposure on this cassette. Okay, so we've got our 40-inch SID. We've got our sponge, we've got markers, and the cassette. First view we're going to do is the PA for digits 2 through 5. So we're going to get started. We're going to shield our patient. And since Amy is a female, we're going to also make sure and ask if there's any possibility of pregnancy. So for the PA, just like a hand, we want the distal end of the third metacarpal to the center of the film. And we'll throw a marker on there. And we can kind of bring the fingers close together. We just want a little bit of space between them so that we don't want to have them superimposing. And we can kind of collimate down, but just make sure you're not clipping anything. And that's the PA for digits 2 through 5. Okay, now we're going to do the oblique. And for the oblique, we're just going to do an oblique hand just like you guys already learned. So we'll just throw this sponge underneath there to make sure we got the finger straight so we have open joint space. And throw the marker on there. A little bit of collimation, just don't clip. And that's the oblique. Alright, now we're going to go ahead and do the lateral, and for each of the fingers it's different. So we're just going to start off with the pinky. We're going to center the proximal interphalangeal to this proximal interphalangeal joint. And so we'll start with the pinky. Go ahead and put your pinky out. Pick it up a little bit. Okay. For the pinky and or for your 5th and your 4th digits, you're going to have that side down. So for the next one, we would take the sponge, the radiolucent sponge, and put it in there so that we can keep the other fingers out of the way and still center to the proximal interphalangeal joint. And for the 2nd and 3rd, go ahead and, or the 2nd and the 3rd, again, same thing. We want the finger as close to the cassette as we can get it so we have minimal OID. So we're going to turn her hand around instead of having her like this. We're going to turn it around. And then same thing for the third one. We'll put that radiolucent sponge in there again and center to the proximal interphalangeal. Toss a marker in there and we're good. And that's it for the laterals for 2 through 5. Okay, so now we're going to go ahead and do the thumb, and the thumb's just a little bit different. We're going to start out with PA projection of the hand, which is 2 through 5 are PA, but if you notice, the thumb is already a perfect oblique, so we don't have to worry about that. So you still center the same distal end of the 3rd metacarpal. So for the lateral thumb, you take the hand and you actually roll it medially so that the thumb ends up lateral, and you still include the whole hand. Calm it down just a little bit more. And just make sure you're not clipping anything, any soft tissue or anything. And there's your lateral thumb. Now we're going to do the AP thumb. And we do it AP because if we did it PA, we would have a lot of OID. There's a lot of distance between where my thumb is and where the cassette's going to be. So I'm going to have her turn around and put her thumb flat on the cassette, and then we'll collimate down to just the thumb. And mark it, and make sure that the interphalangeal joint is to the center. Okay, so to recap, for the digits we have 3 projections. We're going to, for 2 through 5, we're just going to do a regular PA hand, and then oblique hand. And then for the laterals, for 4 and 5, we want the ulnar side down so that we have reduced OID, and for 2 and 3, we want the radial side down so we have reduced SID again. And you collimate down, and you center to the proximal interphalangeal joint for the laterals on the fingers, and you collimate down so that you're including part of that next metacarpal. And then for the thumb, we do again a PA hand, but that makes the thumb oblique. And then we medially rotate the hand so that we have a lateral thumb. And then for the AP, you've got to have them turned around like this so you have lower OID.